What is a penile implant? Penile implants are devices placed inside the genital area to allow men with erectile dysfunction, or ED, to obtain an erection. This is often recommended after other treatment options fail. There are two main types of penile implants: semi-rigid and inflatable. Each type of implant works differently. The most popular is the inflatable penile prosthesis because it closely mimics penile sexual function. While penile implants allow men to get an erection, they do not increase sexual desire or sensation. Also, penile implants will not make your penis any larger than it naturally is. The sole purpose of a penile implant is to make your penis rigid enough for penetration. The procedure. Penile implant surgery will usually be done as an outpatient procedure at a surgery center or hospital with one overnight stay in the hospital. The most common penile implant we do is the 3-piece inflatable penile prosthesis. This consists of a fluid-filled reservoir, a pump with release valve, and inflatable cylinders. To achieve an erection, you pump the fluid from the reservoir into the cylinders located in the shaft of the penis. Afterward, you release the valve to drain the fluid back into the reservoir. To begin the procedure, you will be given general anesthesia or spinal anesthesia, as well as IV antibiotics to help reduce the risk of infection. The surgery site will be shaved and a small incision will be made at the top of the scrotum, just below the base of the penis. 2 inflatable cylinders are placed inside the penile shaft. Your surgeon will choose the proper size cylinders based on intraoperative measurements. The fluid-filled reservoir is implanted under the muscles of the lower abdomen or in the pelvis next to the bladder. The pump is connected to the reservoir and sits under the loose skin of the scrotal sac between the testicles. The surgery will take approximately 1 hour. Risks and complications. Complications of penile implant surgery rarely occur. As with any surgery, bleeding or infection is a possibility. In extreme cases of infection, we may have to remove the implant and replace it with a new one. The antibiotics you are given before and after surgery should reduce this risk. If you experience extreme pain or develop a new pain that wasn't there before surgery, call your physician's office immediately. Another less common complication is erosion of the implant through the urethra or the scrotal incision. If this occurs, the implant will have to be removed and a new one will be put in at a later date. The overall complication rate for placement of inflatable penile prostheses is about 2% every 5 years. A common occurrence to penile implantation is constipation. Painkillers tend to cause constipation, which is why we encourage our patients to take a stool softener twice a day before and after surgery. Prepping for the surgery. Before your procedure, we encourage our patients to wash their genital area daily with Hibiclens antiseptic soap at least 3 days before surgery. This will help reduce the risk of infection. You should also start taking Colace or Miralax at least 3 days before surgery to help with constipation that may occur after surgery. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you must arrange for transportation after the procedure. What to expect after surgery. When you wake up, you may possibly have a Foley catheter in your bladder. You will be wearing a lot of dressings and netted underwear, and ice will be on your scrotum. You will also have a small drain in your scrotum. You may stay overnight at the hospital for monitoring. The next day, the Foley catheter and drain will be removed to see if you are able to urinate on your own. If you cannot urinate after the procedure, you will be sent home with a catheter in place. We will schedule an appointment to bring you back in a few days to repeat the voiding trial by seeing if you're able to urinate on your own. By this time, most men are voiding without difficulty. At discharge, you will be instructed to take stool softeners or mild laxatives to help prevent constipation, which will be prescribed to minimize discomfort. You will also be prescribed pain medication to minimize discomfort and antibiotics to minimize the risk of infection. You will need to keep an ice pack on your scrotum for 24 hours after discharge. You can start bathing in 3 days. We ask that you take a sitz bath 2 to 3 times a day. It's best to wear secure underwear to keep the penis laying on the front of the abdomen for healing purposes. Also, you will need to feel the pump daily and make sure it is down in the most dependent portion of the scrotum where it belongs. There's a tendency in some instances for the pump to migrate up, so we want to make sure it heals in the right location. Results: there will be some pain after surgery. Usually the pain is most intense 2 to 5 days after the procedure with gradual improvement. You will need to take it easy the first few days after the procedure and increase your activities as tolerated. You can return to light activities or work within a week, but some patients will not be able to go back to work for 2 weeks or more, depending upon their pain tolerance and job requirement. Most men can resume strenuous physical and sexual activities about 6 weeks after surgery. During this time, your physician will recommend fully inflating and deflating inflatable penile implants twice a day to give you practice using them and to stretch the area surrounding the cylinders. This may be sensitive at first, but over time the pain will subside. For most patients, the implant should last for 10 or more years. As mentioned previously, it will not affect sexual sensation. There is a 92 to 94% satisfaction rating on penile implants for both the patient and their sexual partner. For many men, a penile implant is an effective and reasonable therapy for treatment of erection difficulties. Your urologist and clinical staff will answer any of your questions and provide additional information to help you decide if penile implant surgery is appropriate for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure. Your nurse or physician will be with you shortly to answer any further questions that you might have.